Welcome back at 7:42. With colder weather comes the spread of germs, and now more health experts are warning to be mindful of the flu this year. The American Medical Association says last flu season was one of the worst they have seen in the last 15 years. Dr. Lase Ajayi, a pediatrician and American Medical Association board chair, joins us now. Doctor, thanks for being here on Good Day Chicago.
Thank you so much for having me. Pleasure to be here.
Okay, so let's talk about the flu season. Why do we know it's going to be so bad, and what is the best way that people can protect themselves?
If last year is any indication of how bad the flu season is going to be, we're in for a rough time, and the best way to prevent it is to get that flu shot.
For people who may be hesitant to get the flu shot, what are some other ways that maybe they can protect themselves?
Absolutely. So we do recommend for anyone 6 months or older, the flu shot really is the best way to prevent the flu and complications. But other things that you can do, I've got 2 kids at home. I tell them that, cover your mouth to the vampire cough, washing your hands. And if you start feeling those symptoms, stay home if you can.
What are some of the preliminary symptoms of the flu? Because, sometimes you get sick, especially during the colder months, and you're like, is it a flu? Is it just a cold? How do you differentiate?
Yeah, and it's really hard. One of the things that we look out for the flu specifically is when you start having the body aches, the fatigue, and those fevers. Those are some clear signs that you may have the flu, and you may want to stay home.
And if you were my best friend and I was going to call you up and be like, okay, my kid has the flu, what do we need to do right now? What kind of treatment would you recommend?
Honestly, we push plenty of fluids, and rest is the best way. But if you're my best friend, if you're my best friend's daughter or child, I'd say if you can't keep those fluids down, you need to come see a doctor as soon as possible.
Okay, thank you. And then who is primarily at risk for the flu?
So we know that pregnant women, young kids, those who have medical complications like diabetes, heart disease, and those who are age 65 or older are more at risk for having complications from the flu.
And young children, they are so susceptible to some flu strains. What is the best way to protect them?
I would 100% say the best way is to get the flu vaccine. If you're 6 months or older, please do get it. It's the best way to keep your kids safe and really reduce the risk of spread.
Okay, let's talk about hospitalizations, because oftentimes they can be great this time of year. Are we seeing an increase in influenza-related hospitalizations so far?
So I can speak locally. We're starting to see that uptick. I'm a pediatrician, so we're starting to see those numbers increase in my children's hospital. We don't have, the flu really peaks in February, and so the fact that we're seeing increase in hospitalizations now is not a good indicator.
Okay, so if people in the household, doctor, are infected, as much as I'd love to have my husband quarantine in the basement for a week, that's really not a reasonable thing. So what are the best ways to protect others in the household if someone's sick?
Yeah, I would say keep those hands clean, wash them as often as you can. And if you feel comfortable and your husband feels comfortable, I'd say wear a mask. It really does reduce that risk of spread. Wearing a mask does if you have somebody who's infected in the household. But then again, cover your mouth like that face covering when you cough or sneeze. Reduce what you can as you kind of like spreading those respiratory droplets.
All right. Thank you so much, doctor.
Absolutely. Thank you again for having us. And again, get those flu shots as soon as possible.